Oral health is a critical part to overall health and well-being, and yet we have not valued or realized the importance of oral health. So we have not built it into our systems of care. We've not rewarded those who provide it. So attitudes toward it have been barriers to access to oral health care. Part of that is just not realizing the importance of it, but part of it is the difficulty of accessing the system. And I think nursing is key to that. I think nursing ought to be incorporated in this major move to improve not only access to oral health services, but also the quality of care. The major trend that I think is important for nursing education is incorporating oral health care as a key part of overall health and well-being.
Nurses have an important role to play for many reasons, but one is by virtue of our sheer volume. There are 3.1 million nurses in the United States, and if every nurse took up the cause of oral health, we'd have that many more eyes and ears on the issue. We have 400,000 physicians in the United States, 300,000 dentists, 3.1 million nurses. And so we can make an extraordinary difference in terms of screening, intervention, and total health of the body and the person. So what follows from that, of course, is that we can change the whole playing field in terms of access. Every person who comes to a nurse can have access to an oral health examination, to a prevention plan, to a treatment plan, to a referral plan. It opens up a whole new world of possibilities for oral health.
For the longest time, I've always had low self-esteem, and a part of it was because of my teeth, because people are very judgmental about things like that. They pick at the littlest things, and I knew my teeth were not the greatest, and I just realized that I had to face the facts that, I had to have all 4 of my front teeth pulled out because there was no way they could save the teeth because they were decayed beyond repair.
It's really the ounce of prevention is much more cost effective than a pound of cure. Nurses, as we all know, are at the front lines of healthcare. Advanced practice nurses, nurse practitioners, clinical nurse specialists, and nurse midwives are really at the front lines of providing primary care and specialty care in a variety of settings. And they really are in a prime position to both do oral health screening, assessment, exams, and management of specific oral health problems within their scope of practice, or make referrals to the appropriate provider. We need to come up with innovative ways to infuse oral health content into undergraduate and graduate curricula. And along with that, to create clinical experiences for students that will enable them to put that knowledge base into action in the clinical arena. We want them to implement effective oral care that increases the quality of care and the quality of life for patients across the lifespan.
I'm excited about a curriculum that already exists. Smiles for Life begins with sharing with all of us as learners the importance of that oral systemic connection, the connection of oral health with overall health and well-being. And it then covers oral health across the lifespan, beginning with caring for children, caring for the pregnant patient, caring for the adult and older adult. We are going to take Smiles for Life and actually integrate it here at NYU College of Nursing throughout our nursing programs, and start out with faculty development and provide our faculty with the tools and techniques and strategies to take the existing Smiles for Life curriculum and actually bring it into the classrooms, bring it into our simulation labs, bring it into our seminar discussions with students.
That's the package that the graduate can take with him or her to the clinical practice setting, and it's part of the lifelong learning that the practicing clinician needs to continue to acquire as they continue their career.
Historically, we've really separated oral health from health of the total person. And so all of us need to be thinking holistically. A nurse needs to be aware of the fact that when a person comes into their practice site, they come in not only with their vital organs, their heart, their lungs, their functional needs, but they also come in with some very significant oral health needs, and that needs to be integrated back into our daily practice.
The mouth is a window to the body overall. That window can tell you a lot about what's going on in the body in terms of diagnosis. But by the same token, diseases of the mouth can affect the heart and the whole system, and with a disease like diabetes, for example.
I guess you could say it takes a village, or it takes multiple health professionals collaborating in an interprofessional way to really come up with a comprehensive solution to the problem.
The idea is really about getting providers to talk to each other, to provide a patient-centered care. And so I think a lot of those conversations are happening now. The interprofessional collaborations that we're seeing across the country, really, in many universities, I think ultimately will lead to more coordination of care across settings, across disciplines, which will improve patient outcomes. I think we're getting a greater understanding that there are certain aspects of preventive care that across the board health professionals can provide. Think about it from the patient's perspective. What is the value added to a patient of having professionals work interprofessionally? The value is that the patient gains from the knowledge of a team of professionals that are taking care of them, and that their health professional is not siloed in their sort of knowledge base either.
The other exciting potential for nurses, of course, is the fact that we are in so many venues. We're in hospitals, we're in home care, we're in long-term care, we're in industry, we're in schools. Wherever there are people, there are nurses. And so that is an incredible opportunity. We're integrated and we are the glue of the healthcare system. And so right off the bat, it's immediate to all of us that we can make an important difference.
I think NYU's nursing initiative is really important. Their commitment to improving access is real, and they play a leadership role. NYU can be an exemplary model. I think it's one that's needed. And I think obviously nurses who care so much about patients would readily follow this lead throughout the country. I'm very pleased that there's this excitement about improving oral health care in this country.
The way my teeth looked before really did make a difference. Now I know that people are not just staring at me because I have rotten teeth in my mouth. No, they're staring at me because I'm smiling and I'm a happy person and I'm confident in myself. Whereas before I wasn't confident in myself. And I was always trying to hide my smile. And now I don't have to.